Good morning and welcome to ActiveNet Scotland Online. I'm really sorry that we're not actually with you in person at Crieff Hydro. Really looking forward to coming and using that hotel, but we will be there on the 7th of September 2022. Need to say a big thank you to all of our speakers, our supplier delegates, operators, and of course First Event who are hosting behind the scenes today. And hopefully you won't have any contact with them because everything will work as expected. This is our second event that we've delivered online, and I really hope that you make the most of the keynotes, the breakout sessions, all of the open networking and the one-to-one meetings. All of these can be accessed via the interactive agenda that you've received. Just hover your mouse over the different sections of the agenda and that will open up the software for the networking and for the meetings, the one-to-ones. Just before we commence with our speaker sessions today, I do want to get people to think about the title of our work that we're talking about here, and that's bridging the gap between leisure and health. And I just wanted to draw your attention to some research that highlights the value of providing physical activity opportunities within the communities. Glasgow Caledonian University research with Sebastian Chastain on the immune response of regular activity. It's a really interesting paper, and it concludes that regular, moderate to vigorous physical activity is associated with reduced risk of community-acquired infectious diseases and infectious disease mortality. It enhances the first line of defense of the immune system and increases the potency of the vaccination. I'm going to put the link to the paper so people can have a read of it, but it's really interesting to see how the work that we do and do so well within our sector can make such a difference to people's lives, particularly at this moment in time. We're so pleased to have such brilliant speakers that are able to reflect on the opportunity to understand how health and physical activity is intertwined. And it's so well expressed by Public Health Scotland's focus on prevention and early intervention, where they aim to increase health, life expectancy and reduce permanent mortality, premature mortality by responding to the wider detriments that impact on people's health and well-being, using data and intelligence and a place-based approach to lead and deliver on Scotland's public health priorities. And to see the work that Sport Scotland does within the Changing Lives agenda is really interesting. A big thank you to all the operators who are attending today. All have got substantial challenges in the workplace at the moment, and we're really grateful for the commitment we've had to this event. And then finally, thank you to the Scottish Leisure Network Group. Without their support and the brilliant work they do to share good practice across the operators in Scotland, we wouldn't have been able to run this event today, and we certainly wouldn't be able to run the event that we plan on the 7th of September. That's enough from me. I'm now going to hand you over to Mike, who will introduce you to the panels and chair the first panel session. Have a great day. Thank you for your time.
Good morning, everyone. Thanks for that introduction, Dave. It's good to be back with our second online event. And as Dave says, we're really looking forward to getting back face to face, but these online events are going very well. And one of the best parts of them is definitely the keynote panel breakouts. We've got an amazing lineup for this keynote panel, which, as Dave said, is all about bridging that gap between leisure and health. So I'm going to briefly introduce you to the panel. I'm always fascinated by how people get to the positions that they currently hold in our sector. So I've spent 5 minutes doing a little bit of trawling back into LinkedIn profiles to find out what people were doing 10, 20, or in Tara's case, about 40 or 50 years ago in the sector. So I'm going to ask them just very briefly about something that they used to do and how it got them to where they are today. So without further ado, I'd like to introduce you to the panel. First of all, we have Flora Jackson, Health Improvement Manager with Public Health Scotland. Flora, I discovered that back in the late 90s, you were a community health and fitness officer with Midlothian Council. Have you always been in this field, or was there anything else that you did before getting interested in health, fitness and leisure?
No, I think before I saw the light, so to speak, I was actually a PE teacher. So that was where I started.
Excellent. Okay, I think it used to be the route in to our sector a lot, didn't it, PE teacher? And so I went to Loughborough, and and originally my training was half PE teacher, and a lot of those people are still in our sector. Thanks for joining us, Flora. Next we have Stuart Harris, Chief Executive of Sports Scotland. Stuart, it wasn't any problem finding out something really interesting about you. International basketball coach, I understand. How does being an international basketball coach help you with your current role, would you say?
Oh, easy question. Being originally a teacher to trade, but also a coach. So I use these principles. I've used them in every stage of my career, Mike, and that's stood me in good stead, both with athletes, young people, and now also with the sector.
Excellent, excellent. Okay, look forward to seeing how you manage the questions later on, and hopefully we're going to have some challenging ones from the people that are watching. And next we have Dawn Ann McHenry, Engagement Operations Manager for the Scottish Leisure Network Group, who have helped us organise the session today. Dawn, I went back into the realms of past time with you and found that you were a system implementation consultant with advanced payroll services. So how do you move from that to working in the leisure sector?
Well, probably I think the first thing is literally it meant a smaller badge as such sort of thing. Between my name and a title like that, my goodness, we needed word wrap on it. Yeah, my first job was I came out having done an arts degree and then did a master's in business and IT, and really needed to learn about IT and things like that. But anyway, the payroll job was essentially, I'll be showing my age, it was modems and dial-up connections and baud rates and things. But for me, my passion was in IT, but then everything, I then moved into leisure management systems. So everything I've learned about leisure, I've actually had the privilege to learn directly from the operators. So yeah, a bit of a change of career, but I don't regret it for a moment. No,
it's a great sector to work in. Next, we've got Kirsty Cumming, CEO of Community Leisure UK. Kirsty, I understand that you started off as a translator. Can I ask what sort of languages you were translating?
Yes, yeah, I did my degree and my master's in translation, so it's French and Spanish that I did.
And do you find that useful at all in your current role now, or?
Sadly not, but when Community Leisure goes international, then we'll have use for it. So in the future, maybe. That's
when you'll come to the fore, isn't it? Next, we've got Tara Dillon, CEO of CIMSPA. Again, quite easy. I knew what you did before. So I've changed the date. Back in, I think it was the 80s, Tara, you were a lifeguard at Swindon Oasis, which many of us will remember at the time being state-of-the-art centre. How's that lifelong experience in the sector helped you in your current role, would you say?
It was 87, Mike. March 87. Yeah, so yeah, followed the typical route, really. Lifeguard, supervisor, duty manager, assistant manager, swim teacher, group X instructor, fitness instructor, then general manager and contract manager. So yes, I've done the sort of typical leisure career route, and then became head lifeguard really when I was MD at IQL at RLSS 15 years ago. So before I did this. So yeah, I've got some stories to go along with it.
Yeah, we'll save those for later. Okay, and finally but not least, Hugh Edwards, CEO UK Active. So Hugh, the furthest back I could go with you was senior coordinator at the Mayor's Office for the Greater London Authority. Who was the mayor at that stage?
Yeah, morning everybody. It was Ken Livingstone, and I spent a lot of my time lobbying for greater funds for London, which I know will go down very well with this audience. But also worked on some of the conceptual work which led to the successful bid for London 2012, which was obviously a moment of great moment for the whole of the UK. So.
Excellent. I'm sure you've got a few stories you could tell later as well. Brilliant. Well, that's your panel for today, everyone. I'd like to start off with going back to Flora. I'm just going to ask everyone to do a quick 2 or 3 minutes opening statement, really, on where they see us at the current situation is in this great task we've got of continuing to strengthen the case for and the linkage between leisure and health. So Flora, would you like to kick things off, please?
Yep, certainly, more than happy to do that. So this is a hugely important agenda and one that's very close to each and every one of us that's either here to talk to you today or indeed those of you who are listening. So I guess from me, we saw the origins of this emerging over a number of years, even way back when I was working in Midlothian many, many moons ago. The notion of how we better link up leisure and health, even back then, was a challenge, and it's still up to a degree a challenge now. So within a public health context, we saw a significant change in the public health landscape in Scotland in recent years. We went through a significant period of public health reform, which meant they did a complete rethink and review of what public health meant to Scotland. And it very much opened up the doors and provided a clear recognition that to address the public health challenges of Scotland, it was very, very clear that the solutions didn't sit within the health sector, but actually required us to reach out and work more collaboratively with folks working in a number of different sectors. And sport and leisure is a key sector in that respect. And that's allowed us in the last couple of years to work far, far more closely with many of the colleagues on the call, particularly with Stuart Harris at Sport Scotland and also with Kirsty at Community Leisure UK. That's seen us embark on a really bold and ambitious piece of work, which has brought us into a true formal partnership agreement with Sport Scotland, so that we will work hand in hand in the work that we take forward together in the coming years. So we're still at the early days of that journey, but so far it's been really, really productive. For me, the key to this is really about how better we build trust and confidence between both sectors. Now, public health, Scotland in particular, is only a small part of that jigsaw. The health sector itself is huge. And really the biggest player within that is NHS Scotland and all the territorial health boards that exist within it. And it's about how we better build relationships strategically across public health generally, but also within NHS Scotland, and then further down the tree in terms of how we engage with our territorial health boards. And for many of you on the call today, certainly those will be the folks that you'll be engaging with daily and frequently. The evidence for this work is really, really strong. If we look internationally at what we know works in terms of increasing population levels of physical activity, then there are two key elements that stand out for us really strongly. The need to look at how we can create more around the development of a concept around sport and recreation for all, so we can see greater inclusion, we can reduce inequalities and ensure we have equity of access. And then from a health sector's perspective, it's about really using the 150,000 folks that we have employed within the NHS in Scotland to drive forward and be the message givers around physical activity. So how can we better equip our health service staff to deliver physical activity brief advice? If they're conveying those messages and we do that at scale, then we're instantly increasing the demand for services in terms of activities within local communities. If we're able to reach out and address the needs of local communities and have a better understanding of the individuals within those communities, then we can much greater achieve health improvement across Scotland. I'll leave it there. I think I've probably burnt my 3 minutes.
Thank you, Flora. No, that's perfect. That's a good setting the scene. It's a really nice lead in to you, Stuart. You guys are obviously working very closely together. Would you like to build on that from Sport Scotland's perspective?
Yeah, absolutely, Mike. So let me take a quick jog through what's in place for a more aligned, collaborative approach to health and wellbeing in Scotland. Critically, though, given where we've been with COVID, this is now the time to ramp up the collective effort towards a more preventative approach. It's a strong statement, but I think it's one that's really important for us all to understand. What's in place? I'm going to give you a long list of what's in place, some of which Flora's already mentioned. So there's a portfolio alignment between Public Health Scotland and Sport Scotland. We share a Minister of Public Health, Sport and Women's Health. We're in the health portfolio. Again, that really helps. We've got a strong partnership in place, which is formalised at a leadership level. And we've got good relationships with local partners across all 32 local authorities in Scotland. The evidence is you can't refute it anymore. It's the physical benefits, mental health benefits. David mentioned the immune system work that Sebastian Chastain did. Phenomenal stuff. There's a synergy between policy drivers. I'm going to talk a bit about that in a sec, just to prove the point. Critically, we have an infrastructure in physical activity, sport and leisure that can contribute much more to the health of the nation than it is currently given credit for. And I think it's important that that statement is strongly repeated by all of us whenever we have the chance. And for me, what's a critical piece is that commitment to system design that the likes of Glasgow, Dundee and other partners in Scotland have, which is grouping together partners for that common health and wellbeing outcome, which sport for me is only a small part. Quickly on the priorities, public health have 6 priorities. One of them is live in vibrant, healthy, safe places and communities. Flip across to an active Scotland framework and it's support wellbeing and resilience in communities. Tick, snap. Flourish in early years, public health priority. Develop physical competence and confidence in early years. Snap again. Eat well, have a healthy weight and are physically active. Encourage the inactive to be more active. Again, snap. So you can see the synergy. A shorter list now for what is needed. And this is where some of the debate will be, I believe. And you mentioned earlier on, Mike, about challenging questions. I think we all need to challenge each other and other sectors about this. So what's needed? Political vision and support, both nationally and locally. It's not one or the other for that preventative agenda. Maybe all the announcements yesterday can kick that off. Commitment from agencies to work together properly, formally, and with accountability. And also, again, to underpin all of this, there is a national direction, but it has to be applied locally to what those priorities are. So lastly, let's all, in both sectors, spend more time influencing beyond our own comfort zone, which is talking to each other, and talk to other sectors about the role that they can play, and all of us be advocates. So looking forward to the discussion. Mike.
Brilliant.
Thank you.
Thanks, Stuart. That's excellent background. Dawn-Ann, do you want to say a few words? I guess we're now moving into the speakers on the panel that are more involved on the operator and physical facility side of things. So yeah, Dawn, over to you.
Absolutely. I mean, the members that we represent, so for the Scottish Leisure Network Group, we represent the leisure operators of Scotland, so that's across the trust, the local authority, university, education, universities and colleges. But one thing that the SLNG has witnessed is actually the benefits of bringing people together. And I think when we look at this pandemic that we're living through and living in, one of the positives that's came out of it is collaboration, a word that actually Flora's already alluded to. And I think, as Stuart's saying there's a real opportunity to develop and build relationships, because the leisure operators that we represent are the guys on the rock face delivering the services. But I think there's a real opportunity, again, on behalf of the members to develop a more cohesive approach to tackling Scotland's chronic health conditions, because they affect all of our communities. But not only just that, but is to encourage and support more people to become more active more often. And we can only do that by all having a chair, a seat at the table and coming together.
Brilliant. Thanks, Dawn-Ann. And Kirsty, just to carry on that theme, obviously CEO of Community Leisure UK, very strong membership up in Scotland. So would you like to carry on that theme, just say a few words from CLUK's point of view?
Absolutely, yeah. Thank you, Mike. I think one of the challenges, or possibly the positive thing about going kind of fourth on this panel, is that a lot of what I would say has already been said by the first 3 speakers, which is great in terms that we're all clearly on the same page. But I guess, when I saw the agenda for today's event, I was really, really pleased to see that health was, the headline topic for the opening panel session. And I think that's, absolutely right. And I think it really emphasizes the position that we all accept, that should be that connection between health and leisure. I think from a community leisure perspective, we've seen public leisure and sport being on a bit of a journey over the recent years. And we had a lot of kind of questioning and looking for identity and kind of moving through developing of the sector. But what's clear from our members certainly is that, you know, they absolutely see themselves as supporting the health and well-being of communities. You know, that's their absolute core purpose, and it's very much around being well-being services. So it's a very clear identity within our membership of where they think they can support and where they think they should be, you know, within that kind of landscape. I think we've seen that that's only been emphasised in the last 12, 18 months during the kind of pandemic periods, and public leisure's really kind of stood out, I think, in terms of remaining operational. So despite buildings and venues being closed, actually our members have all still been operating, delivering digitally, delivering via telephone, and in some cases, you know, individual outreach work with particularly vulnerable people within communities, you know, obviously within COVID guidelines. But I think that really, again, reinforces the position around wanting to support health and well-being. We've also recently published a document, which I'm kind of unashamedly plugging here, so apologies for using the platform, but we published a document outlining how our members contribute across the 6 public health priorities that Stuart referenced there. And there's really some fantastic examples within that, but I think what was particularly interesting is there was perhaps a perception from beyond our sector that actually our members would contribute, particularly around the priority around being physically active and healthy weight, which absolutely is true. But right across all 6 priorities, you know, our members have got really, really strong contributions. And that's just something that they see as their everyday kind of core work. It's not something they're trying to specifically do. So we're trying to kind of capture a lot of what's already going on. And I think, again, kind of echoing Stuart's points, that actually there's a huge potential for the kind of physical activity and sports sector to really do more and to really be recognised as part of the wider public health sector. And the more that we can kind of keep championing that message, you know, the better it will be for everybody, for communities, for our members, but also for colleagues in the health sector. So I think there's, you know, great opportunity as we're kind of moving into the recovery period. I think we've also seen collaboration between a number of the organisations on this morning's call, which has been great, you know, and it's opportunities to have conversations about that closer working. But I think one of the key things we need to look at is carrying our message outside of, you know, this sector and carrying it right across and not being guilty of kind of talking to each other in silos, which I think maybe in the past, you know, was the case. So kind of positive, forward-looking, but certainly some challenges along the way. Thanks, Mike.
Yeah, definitely. Thank you, Kirsty. Okay, over to Tara. CIMSPA's point of view. What would you like to say, Tara?
Thanks, Mike. Well, like Kirsty, being 5th in the pecking order, I could almost say what everybody else said. I think the watchword this morning is collaboration, and what tends to get in the way, particularly when it comes to health, I'm sure Flora will not frantically when I say it tends to get in the way of big ideas and good strategies is bureaucracy. It tends to snarl things up and slow things down. And the construct of this collaboration, people on this call actually, lends itself very well to knocking through the bureaucracy. Collaboration cuts through bureaucratic process, it just does. And what's unique about the collaboration between Public Health Scotland, Sports Scotland, and the shared minister, and that is, you know, some might say that's a bonus. I don't think it was an accident. I think it was intentional. And I think in terms of advocacy, going back to Kirsty's point around making sure we're not, you know, screaming into our own echo chamber, that's a huge advantage. In terms of advocacy. So, but also what's particularly encouraging in Scotland is that the big agenda, you know, we talk quite generally about our impact as a sector on reducing the burden on the NHS, which is a fantastic ambition to have, but it's very difficult to qualify and quantify. Where that happens is is through the development of population based networks, contributing to an overall strategy through a systemed approach. And that is, in all 4 home nations, Scotland is closer to that than anywhere else, because each of the satellites in this collaboration, just on this panel, and also the people on the other side of this panel, the operators, all have excellent practice and excellent ambitions and strategies. The important thing is connecting, not having a hierarchical structure, but having a matrix around this network that keeps that momentum. Now, the one piece of work that we're also collaborating with Flora and Stuart to ensure that the skills required to keep that momentum and to prove the point actually are constantly developed. So, and that again is unique to Scotland, is that our work will help facilitate upskilling, our brilliant workforce in Scotland in areas of skills where local need can identify it. So instead of having sort of generalists, we can talk about, let's go back to Midlothian, let's go back to Flora's first days, where there are health priorities in that particular location, and there is Public Health Scotland, the Territorial Health Board, local authority, the leisure providers, Sports Scotland, all coalescing around those priorities. We can then identify the skills, our input as a sector, identify the skills required to do them, develop those skills, all agree on them, and then deliver them back into the system. So the ecosystem, the network that I talk about is perpetual, as opposed to trying to do it big at scale, which often gets snarled up by bureaucracy. So I'm really encouraged, Mike, by the progress made in Scotland, and that collaboration between health and sport, the two big organisations on this panel, together with Community Leisure and SLNG, so having the operators at the table, you're halfway through the bureaucracy, frankly, and you are developing a national activity therapy service that just needs switching on, as opposed to you need to go through lots of red tape and paperwork and who's going to fund it. It pre-exists successfully. You've just got to make the cogs connect.
Brilliant. Thanks, Cara. Apologies for being last to you, but I'm sure there's plenty you can pick up on and add to for a few minutes now. Thanks.
Yeah, no problem, Mike. Look, from my perspective, there's twin tracks here. There is, a number of the operators and wider partners on the call will remain in that survival and recovery track, and testament to the work that the operators have done in Scotland, especially around making that their services the highest, the benchmark in terms of health and safety around COVID levels. The stats that we put out last week across the whole UK show the extremely low prevalence of COVID, and these remain uncertain times in Scotland as they do in England and other parts of the UK. And there's a huge amount of work which is recognised by the government and their agencies on the high quality work that the sector has done in this space. There's a lot more work and support required and to navigate through the next few weeks and months, which will be challenging. And that's got to be and will be front of everybody's minds, no doubt, on this call. The second is around development. And the reality is that there is no step change in activity levels unless there is that full integration between gyms, pools and leisure centres and health. Now, why is that? Well, because this sector is very much the engine room of activity across the country. It's only second behind walking, drives tens of millions of people into these facilities every week, and can do so much more, as Stuart has alluded to. And just to go back to what Flora said, it's about trust and confidence. Now, what is in our control as a sector is hugely important. What can we do to generate that level of trust, generate that level of confidence, which will drive and support those conversations in terms of full integration? Now, from our perspective, there's no going back to pre-COVID days. Life has changed. We move forward. Expectations are higher, especially around customers and diversity of customers that we want to bring in. And so the areas that ukactive is working on with Tara, especially around workforce and around wider partners, is around a number of areas. The full utilisation of data, the raising of standards, both health and safety standards, but wider societal standards across our whole network. The full integration and embracing of digital, which I know is coming up later today. The embracement of inclusion, whether that be gender, whether that be LGBTQ, whether that be disability. Where do we raise our standards? infrastructure, how we work together on making sure our infrastructure is fit for purpose, working with the government as well. And then we look at how we make sure that we are providing a service irrespective of age and background. You know, the report that ukactive produced a few months ago around active aging is very prescient right now when you're looking at the conversations around social care and aging and an aging population. And none of the conversation in the last 24 hours in Westminster has been around where it's actually cheaper to prevent illness than it is to treat it. That's our opportunity as a sector. We need to build trust and confidence. We need to work with the government and its agencies. But it's about evolution and modernization to make sure we're playing our fullest role. And I have no doubt from the conversations I had with operators across the country that is a prize that they want to grasp. And then it's a question of how we then work out the art of the possible with the government and its agencies in order to deliver that. Thanks, Mike.
Brilliant. Thanks, Hugh. Some excellent opening statements there. Kate, let me know if any questions come from the audience. There's two things I really wanted to pick up on straight away, though. I thought it's a great point from Kirsty about how COVID has changed the attitude of your operators and forcing them to literally think out of the box. I want to explore what else people think, and I'm using this term in the looser sense of the word. What's different post-COVID? 18 months, 24 months ago, we were in a particular situation and we were still trying to make the same case. Perhaps one for you to start off with, Flora, and then I'll come to you, Stuart. What do you think? How has the whole pandemic changed, the argument, and changed the discussion that we're trying to have with governments, with NHS, with other funders?
I think sadly it's taken us to endure the pandemic for some people to really value the importance and the contribution of physical activity to health. We were very much encouraged that virtually every day in the First Minister's updates, we were hearing loud and clear the importance when you could do nothing else. You were only allowed to leave home for a very short time, but you were allowed to leave home and exercise. And I won't get too hung up about the E word, but get out and move by whatever means you can, or move in your home. So that message was very, very clear. And I think we have our chief medical officers across the UK to thank for that. I think there's huge potential going forward. Now is a great time for us to restart and really focus on how we're going to maximise what we can do together at our best. There's a slight challenge, although I would say that at the moment, there's still tensions within the health service itself, and that the priority for them is still very much focused on the immediate issues as a result of COVID. And there's we don't want that to be too much of a barrier, but I think we still need to be mindful of it. So there's a challenge and an opportunity there.
Brilliant. Stuart, anything to add to that?
Yeah, it's been said a number of times. I mean, the opportunity is, I think now I've seen a change in attitudes from people who maybe weren't in that camp, who were in the separatist type agenda rather than a collaborative, collective piece. We've got to work at the top end with a strong, coherent, unified voice about benefits. I think that's important. And at the same time, work locally on practice, improve that practice. And if we can get the balance right of advocacy, and I believe we haven't got that right in the past. We focused on practice. I think if we balance that now with the policy agenda being unified and the messaging be unified, we've got a chance. This is a real big moment, Mike. I think all of us have to see it, grab it, and move it.
Thanks, Stuart. Kirsty, one for you on a similar track, but I mean, I was in the sector back in the days of austerity, and it was a tough time for leisure operators, and a lot of the funding was cut and leisure centres were closed. Is the next 3 or 4 years going to be any different? How do we make sure that it's different from those days?
I mean, that's an excellent question, Mike. I think our hope is that, as Stuart was saying there, that through the advocacy and through the positioning of the sector and that invest to save, that kind of investment in prevention, that message will begin to resonate. I think we were hoping that on the back of COVID, there might be, a little bit more awareness, perhaps at local authority level. And in fairness, I think there probably is, but we are expecting to see budget cuts into 22-23 in terms of our membership, which is obviously challenging in an already fragile kind of sector and an already fragile landscape. I think one of the challenges that we have as well is that local authorities themselves are under huge amounts of pressure. So we've still got this challenge that sort of leisure, sports, physical activity is still seen as almost a bit of a nice to have, despite all of the messaging and despite all of the positioning that we've really tried to do. Actually, when it's on that list of kind of education, health, social care, it is very much seen as not necessarily within those sectors, but actually slightly further down the list, which makes it inevitably a bit easier to cut in terms of funding. So we really need to push a lot harder, not necessarily for new money actually, but just in terms of protecting what we have and really seeing that, as I said, that move towards prevention and I guess the long-term impact of cuts. If we continue on cutting over years to come, actually where will we be in 5-10 years time, and can we get back from that is really the question. So I think there's a bit of a joined up advocacy and kind of positioning that we really need to work on to really try and make sure that we protect the sector in terms of assets, workforce, but also in terms of skills and value that it has.
Excellent, thanks, Kirsty. One for you, it's coming from Ian McGregor. What steps can we take to ensure that the private sector are included in this effort we need to make to scale what we're doing, encourage more people to come into physical activity? Obviously, we've got very much a public sector bias on the panel and probably in our audience, but it's vital that the private sector are included in this as well, isn't it?
Yeah, absolutely. And I think in the last 18 months, there's been an incredible level of collaboration between the public and private sides of the sector, driven through the existential crisis that we've been through. And there has been a great level of commonality on areas. I think coming out of this, the key word for me is definition. There is, as you've seen post the reopening, from April this year and May, as in terms of phase approaching, there's been in many parts of the private sector, a rapid recovery. Now, what is the key for, especially around public leisure and the work that we've been doing, especially in our thought leadership piece around a decade of change, is around definition. What is defined for us the service that is being provided here? Because ultimately, the evolution, the growth, and the organic growth of what happens in core leisure has not been kept up with the definition of that piece of work and how that's related back to both central and local government. And actually, a key part is actually what is the services being provided here across a range of different interventions, working with a range of different bespoke audiences, which is hugely valuable in terms of the health and well-being of communities across the whole of Scotland. And so definition is going to be hugely important. Defining what the service provides and how it then complements what you have within the private sector services, because the two have to work together if it's going to be an effective proposition going back into the Scottish Government and its agencies.
Thanks, Hugh. One for you, Dawn-Anne, and I'll then ask you to comment on this as well, Tara. A question came in from Johnny Curley. With the massive change on the high street and influx of new leisure offerings competing for leisure time, how do our operators need to evolve to stay current and in demand? And he's making particular reference to the fact that the projections are we're going to see another 300 value/budget gyms, leisure operators coming into UK in the next 12 months. So what's the implications for the sort of facilities that your network run, would you say, Dawn-Anne?
I think the thing that jumps out there is the word digital transformation. This, what happened was everything closed, this pandemic hit, and the only way that operators could actually reach their members was by, moving online. So I think for a lot of organisations, some are doing it better than others, but I think it took a lot of operators out of their comfort zone. It showed that there was real agility and speed to make decisions quickly, to change the way in which they operated. And I think that was good for actually upskilling and building their confidence that they can do it. That whole online classes thing, I kept kicking it into the long grass because I thought it was in the too hard pile. But actually, the sector has actually proven that they can do it, and they can actually do it really, really well. But the thing is, it's still bumpy. They're still learning. They're still refining. So, yeah, I think the public sector in Scotland still, for leisure services, still has a strong offering in comparison to the private sector. But there is all a bigger agenda on the health and the well-being of the communities that we serve, and working together.
Brilliant, thanks. Just before I ask you to follow on, Tara, just to finish off with panel, can you just have a think about one line, a bit of advice to our buyers and suppliers or operators and suppliers that are online about how they can make what they need to be thinking about to make a real difference to community. So just before I go around and finish off with the panel, Tara, anything you'd like to add to what Dawn Ann just said there about how we need to evolve our offering?
Yeah, well, just going back to Johnny's point, actually, morning, Johnny. I don't think we should be nervous about an influx at all. I think it goes back to, I think, just a help. All provision is good. You want to talk about advocacy and supply and demand. That's a healthy thing to have. But there is a definition thing. There's a definition challenge that I don't think is difficult to overcome. Private leisure on the high street is exactly what it is. And people, we know the stats, 15% of people make a decision that they're going to get healthier, better and healthier. And they have lots of choice. Good for them. What's unique to public leisure is that it has a relationship with the local authority. It understands the communities in which it works. It has the ability to reach and have profile. It has partnerships and collaborations with people on this panel. So there's almost a responsibility, actually, for public leisure to do what it's funded to do, which is to work in those communities where they wouldn't ordinarily rock up to a private offering on the high street, and to develop and educate activity strategies as opposed to just sell it. So, and that, again, I'm not saying it just because we're in Scotland today, Mike, that it stands out in Scotland more than any other of the home nations. The construct of public leisure in Scotland is in good order because those relationships and because there are trusts and that connection between local authority and local community is very solid. It's something to be proud of and it's something to work on, because if we're going to prove the point and we're going to create that advocacy, that's where it happens.
Brilliant. Thanks, Tara. I'm not going to have time to go around the whole panel, so I'm going to just ask 2 or 3 of you if you've got a really quick, succinct but important one-liner about what people can do to make a difference. Quick, who would like to go first? Show your hand if you don't mind. So hands up time. Hugh, are you holding your hand up or scratching your chin?
Well, scratching, but I'll go. Ultimately, to break through with the great collaboration, and that there is a great energy to make this work and to have that breakthrough. It's going to come down to the inclusivity of the offer that we provide.
Brilliant, thanks, Hugh. And Flora, I think I did see you put your hand up. Thanks for that.
Yeah, my nose is big, but I wasn't scratching it. Yeah, I would just say one point. Yeah. If we really want to meet the needs of our communities, and I think we're all on the same page, we absolutely want to do that, but we can only do that if we really, really understand them. So let's use the data that we have, let's pull it together from across multiple organisations, and let's really use it to make sure that we can do the best to target and meet the needs of our communities.
Lovely, that's a great line to finish off on. As usual, we could have gone on for another hour, I'm sure. I'd really like to apologise to those people that put in questions. We haven't had time to ask them all. I'd like to thank the panel. It's I think, as everyone is recognising, there's some amazing work going up in Scotland, certainly things that the other parts of the UK can learn from. Just a little bit of housekeeping to finish off with. There's going to be a very quick break now. We've got about 8 minutes break, and then you need to choose your breakout panels. So you've got a choice of 3. Number 1 is the digital approach, number 2 is workforce needs, and number 3 is the Changing Lives agenda. And most of our keynote panelists will be available in those breakouts if you want to carry on the discussion and ask further questions. But yes, thanks very much, panel. Really appreciate your time and some great contribution.